I never thought my journey to America would lead me to a hospital hallway where I would witness something that would change the life of a patient and earn the quiet respect of some of the most renowned doctors in the world. My name is Maria Santos, a Filipino nurse who had spent 10 years working abroad, and I just arrived in Boston to work at a prestigious hospital near Harvard Medical School. I knew that working here meant long hours, complicated cases, and the kind of medical pressure that could crush even the most confident nurse. But I also didn't realize that it would put me at the center of a mystery that no doctor could solve until I stepped in. It began on a rainy Monday morning when the hospital was bustling more than usual. A young man had been admitted with a severe, unexplained neurological condition. His name was David, a 28-year-old software engineer who had started experiencing random seizures, episodes of confusion, and sharp, untraceable pain in his chest and limbs. Multiple specialists had examined him: neurologists, cardiologists, and internal medicine doctors. Tests, scans, and even experimental procedures were performed. Everything came back normal, and yet David continued to deteriorate. The attending physicians were frustrated. Harvard, one of the most advanced medical centers in the world, had staff running on pure adrenaline, juggling the complicated balance between research, teaching, and patient care. And yet, here was a patient none of them could diagnose. Whispers in the hallway hinted an impossible case. I had heard about these cases before: patients with rare autoimmune disorders, metabolic issues, or syndromes so obscure they were almost mythological in medical textbooks. But nothing had prepared me for what I was about to face. I first met David in the ICU, where he had been moved after an alarming spike in heart rate that no doctor could explain. His eyes were wide, confused, but there was a softness in them, a vulnerability that broke through the clinical chaos around him. His family, Filipino immigrants like me, were exhausted. They had traveled long distances, taken time off work, and spent all their savings seeking medical care that promised answers but delivered only frustration. I remember walking into his room that first day, adjusting my mask and gloves, and feeling an unshakable resolve. If anyone could find the missing piece of this puzzle, it would not be the famous doctors. They had their brilliance, yes, but someone willing to observe, to listen, to notice what others overlooked. I began with the basics. Every nurse is trained to observe, not just record vitals, but watch patterns, note reactions, sense the rhythm of a patient's condition over hours. I spent time at David's bedside asking him questions that were outside the usual clinical scripts. When do you feel the pain? Does anything make it better? Do you notice patterns when certain foods are eaten? At first, the doctors were skeptical. I was just a nurse, after all, following routine procedures. But slowly, my observations began to reveal inconsistencies the high-tech machines couldn't detect. One afternoon, after a particularly exhausting shift, I sat with David and noticed something peculiar. He winced almost immediately after drinking a small glass of water provided by the night nurse. It was subtle, a micro-expression that most would miss. I quietly asked him, "Can you tell me exactly what happens when you drink?" His response was hesitant, but clear. "My chest? It burns. Sometimes my throat tightens. I feel dizzy." I brought this to the attending doctor, a neurologist who had been managing the case for months. He frowned, skeptical. "We've checked his esophagus, stomach, and heart. Nothing abnormal." I nodded, not arguing, and suggested we observe the reaction closely during the next meal. The doctors reluctantly agreed. Over the next 48 hours, I meticulously documented every reaction to food, water, and even environmental changes in the room. I noted that David's symptoms were triggered only by certain tap water sources, particularly water from the hospital's new filtration system. I remembered similar cases from the Philippines, where trace levels of certain metals or chemical residues caused severe reactions that standard tests often missed. I shared this with the team, providing detailed logs and comparative notes. At first, the doctors were dismissive. Harvard-trained specialists are not used to suggestions from nurses, even if they are highly observant. But the patient's continued deterioration forced them to reconsider. They ran a series of tests on the water, this time focusing on trace chemicals that standard screenings overlooked. Within hours, the results were in. David's symptoms were caused by a rare sensitivity to trace amounts of lithium and chlorine byproducts in the filtered water. Combinations so subtle that even advanced lab machines had ignored it in standard protocols. It was a moment of quiet triumph. The doctors, initially incredulous, began adjusting his hydration protocol immediately. I supervised each glass of water, monitoring every reaction. Within 24 hours, David's symptoms began to stabilize. The improvement was undeniable. Where once there had been panic and uncertainty, there was now hope and relief. Word of my discovery spread quickly through the hospital, not in a boastful way, but through whispered acknowledgement of the role careful observation played. Some doctors approached me privately, saying they had never considered the connection I had made. Others, initially skeptical, thanked me for insisting on observing patterns that didn't appear in charts or scans. For a nurse, these small gestures of recognition from some of the brightest medical minds in the world were profound. David's family was overwhelmed. His mother cried silently at his bedside, clasping my hand with gratitude that words could not capture. "Thank you," she whispered. "You saved my son." That moment reminded me why I had chosen nursing in the first place. It was never about prestige or accolades. It was about noticing, understanding, and acting when it mattered most. The hospital administration eventually recognized my role officially. I was invited to speak at a staff meeting, where I outlined the observational method I had used, emphasizing that patient care sometimes requires more than tests and protocols. It requires attention to detail, intuition, and empathy. Some younger nurses later approached me, saying they had felt discouraged by the hierarchy, but seeing my contribution reminded them that their insights mattered, that their voices could make a difference. David made a full recovery over the next few weeks. He returned to work, to his life, and even shared his story publicly in a local newsletter. "If not for Maria, no one would have figured out what was happening," he said. "Doctors are brilliant, but she saw what they could not." His words, humble yet profound, spread beyond the hospital. Within months, my story was mentioned in medical forums, nursing groups, and even a few international conferences discussing patient-centered observation. What I learned from this experience goes beyond any individual case. It is a lesson about the power of observation, the courage to speak up, and the unique perspective that nurses bring to healthcare. Machines, scans, and protocols are invaluable, but they cannot replace human attention to nuance, human understanding of context, and human persistence. It also reminded me that miracles in medicine are often the result of small acts, noticing a subtle reaction, asking a patient the right question, and trusting your experience even when others doubt you. When I look back, I realize that being an overseas Filipino worker, the challenges, the sacrifices, the homesickness, the struggle to adapt to a foreign system gave me skills that were unquantifiable. The patience, the resilience, and the attention to human needs are things that textbooks cannot teach. In a way, every hardship I had endured prepared me for that moment when a life depended not on machines, but on my willingness to observe and care. Harvard Medical School is famous for producing brilliant minds, but it is also a place where humility is learned quickly. I was reminded that no matter how many degrees or accolades someone has, medicine is still about humanity. David's case is now studied as an example in some nursing programs, not just for the unusual diagnosis, but for how collaboration between nurses and doctors can solve the unsolvable. I often meet young Filipino nurses and students who ask me how I managed to have such an impact. I tell them the truth. It wasn't magic. It was paying attention. It was caring enough to notice when something didn't fit. It was trusting both my training and my instincts. And above all, it was believing that even in the most intimidating environments, a Filipino nurse could make a difference. In retrospect, the real miracle wasn't that I solved a medical mystery that baffled Harvard doctors. The real miracle was that a young man had his life restored, that a family found hope, and that an ordinary nurse, far from home, could remind the world that compassion, observation, and courage are as powerful as any medical degree. Years later, I returned to the Philippines for a short visit. I sat in my old room, reflecting on that rainy Monday in Boston, and realized how a single act of paying attention changed the trajectory of someone's life. It reminded me that heroism doesn't always come with fame or glory. Sometimes it comes in the quiet, unnoticed hours, standing at a bedside, asking a patient the right question and trusting that your voice matters. And for David, who continues to thrive, I remain an invisible part of his story, a Filipino nurse who listened, noticed, and acted. That day in Boston is forever a testament to the power of human care, the courage of an OFW far from home, and the simple yet extraordinary truth that even when faced with the most brilliant minds, a heart willing to notice can be the greatest tool of all.